Well, good evening, everyone. This is Dennis Stone, Director of the Center for Advocacy and Social Justice at the Jacksonville Urban League. And we're very pleased to have you with us, and also very pleased to have Dr. Frank Catalanotto, who will be speaking about the impact of poor oral health on children and adults, and the crisis really that has occurred in Florida because of this impact. Dr. Catalanotto has served as a professor and dean at the School of Dentistry at the University of Florida, and really has made this his life work for the last 25 to 30 years, trying to help poor communities get better access to oral health. And with that, I'll turn it over to you, Dr. Frank.
Great. Just I tested the slides ahead of time and to make sure that they were working, and they're not. So just hold on 1 second here.
Let me, while you're doing that, I'll put it up on my.
Oh, good. Okay, I think we're working now.
Yes.
So thank you very much. Before we get started, what I'd like to do is ask everyone who is attending, if you would not mind, in the chat function, please put your name and what organization you are working with. We really want to try to keep tabs on the people we are talking with. On the slide is my background and kind of things that I have been involved in for a number of years. Probably the most important thing is the disclaimer on the bottom of the slide that any of the opinions I share tonight are my own and do not necessarily reflect the official viewpoints of any other that I am affiliated with. My apologies, my slide is racing again. Is Marianne on? Maybe I'll stop sharing mine and ask her to share the set I sent her.
I got a copy and I'll put it up.
Okay, I'm going to stop sharing mine.
Okay.
Great, thank you. And my apologies for that. I had it working ahead of time and it was not.
1 second here.
Dennis, you want me to share it? I have it up on my.
If you got it up,
Okay.
yeah, go ahead.
Great, yeah, please do.
Great, thank you. Next slide. So what we're going to talk about today is a couple of topics related to the oral health crisis in Florida. I'm going to probably speak for about 20 to 25 minutes or so I want to leave enough time for questions. So we've got some brand new data that we have been collecting along with CareQuest Institute for Oral Health out of Boston, who is funding our work on oral health advocacy in Florida. I'm going to briefly discuss why this is important, why good oral health is important, and try to convince you that this is a lot more than a pretty smile. This is a big economic factor in our state and also a personal health issue. A little bit about our organization, Floridians For Dental Access, and who we are. And some really good news I got today. We actually have House and Senate bill numbers for the legislation that we are pushing for this year to partially address some of these access issues. And I will mention that near the end of the presentation. And then in a couple of days, we're trying to prepare a cover letter for advocates such as yourself that you might reach out and talk to legislators. And I will share that with Dennis Stone and the folks at the Urban League about the middle of the week, and they can share that with all the participants. Next slide. So we talk about this oral health crisis as an equity issue. And what we mean by that is really a very simple statement that those populations most in need of dental care in this country receive the least. And those populations least in need of dental care, that's primarily middle class and upper middle income folks, receive the most dental care. And the primary populations that are affected by this inequity are racial and ethnic minority groups, low-income populations, rural areas of our state, children, and the aged in particular consequences of this oral health inequities. Next slide. So what I'm going to do, quite frankly, is criticize the dental care system in this country and provide data to support that criticism. But I want you to know that I'm not alone in doing this, and neither are the organization Floridians For Dental Access or the other organizations I belong to. Even the American Dental Association Health Policy Institute has said our dental care system is stuck in this country, and they provide a number of solutions about how to approach this issue. Next slide. Someone's got their mic on. Thank you. So the extent of this problem, all the best estimates and numbers, and again, these are not just my numbers, but the federal numbers and even the American Dental Association Health Policy Institute, about 180 million people in this country do not access dental care on a regular basis, and that has severe economic and systemic overall health implications for them. Next slide. So let's start with a general description of the problem in Florida. Dental health professional shortage areas are defined by the federal government as areas of the state. It could be a county, it could be a town, it could be a zip code, it could be an even smaller location than that do not have the appropriate dentist population ratio, the number of dentists in that community to care for the population in that area. Florida, unfortunately, leads the country in the amount of people living in dental health professional shortage areas. Over 61 million across the country, 10% of that, over 6 million people in Florida live in dental health professional shortage areas. To fix that, one would need over 1,300 dentists. And I can tell you, as a former dean of the University of Florida College of Dentistry, as a faculty member still there, that's not going to happen. We're not going to get 1,300 new dentists in the state. In fact, retiring dentists are outpacing new dentists right now. Although we anticipate that that's going to change somewhat in the near future, but we're not going to fix this with more dentists. And I will also argue more dentists are not necessarily the solution, because the problem, as we'll see in the future slide, is that the primary reason people can't access care is not only that there are not enough dentists, but that cost is the most significant factor. Next slide. Here's another measure of how badly we are doing in the state. This is 2019 data. I'm going to show you 2021 in a minute, but this is what we call Medicaid utilization, the percentage of children who are on Medicaid in the state of Florida who had a dental service last year. You can see as a country, we're not doing very well. The national average is only 52%. But there is Florida, fifth from the bottom of the country, at only 43% of our children on Medicaid in this state got any kind of dental care last year or in 2019. Next slide. In 2021, it's actually a little bit worse. Okay, we've dropped a position down to 42%. Next slide. So what does this mean in terms of the number of children? Maybe 42% doesn't sound too bad to you, but what that means is that 1,784,000 kids on Medicaid did not get a dental examination, treatment, or preventive procedure last year. And in that year, we ranked now second from the bottom of the country. And on any dental visit, and second from the bottom of the country in a preventable dental visit. I have one new bit of data that is not on this slide. So when we look at all the children in the state of Florida, these numbers are still there. In other words, we're looking at dental care for all the children in the state of Florida. We rank second from the bottom in the country. Next slide. Here's another way to look at this. And third grade is a nationally used grade for children, or what we call surveillance studies. We look at all third graders taking selected samples, and we look at untreated cavities. And you can see that Florida is seventh from the bottom, with over 25% of third graders in our state having untreated cavities. And untreated cavities have severe consequences that we will discuss in a minute or two. One more thing as a reminder, we've had some new people join the presentation. If you would, please put your name and your organization in the chat box so we can have an idea who is here. Just take a minute to put your name and organization in the chat box, please. Thanks. Next slide. Okay, so how does this stack up to what the recommendations are? The U.S. Primary Preventive Services Task Force is a national organization, arm of the United States government, that provides recommendations for what kind of dental care children should have. And it says that primary care clinicians, and this can be both dentists or physicians or nurses, should prescribe oral fluoride supplements starting at 6 months of age, should apply fluoride varnish applications before the age of 1, and as does the same recommendation from the American Academy of Pediatric Dentistry. Next slide. This is a slightly different measure than what we had before, but you can see that as a country, we don't do too well on this measure for Medicaid enrolled children. Only 2% of children under the age of 1, but in Florida, it's less than 0.08% of children. There's also a recommendation for the application of dental sealants for children in the ages 6 to 9. Again, as a country, we don't do very well, with about 12% of children nationally getting dental sealants. In Florida, it is only 7%. And again, this has terrific consequences for children. Next slide. Here's one of the results of this. In 2019, when a parent or has a child, or as an adult, has a toothache, has an infected tooth, and can't find a dentist that can provide care for that child or for themselves, or they can't afford the dentist because they call the dentist office and the dentist office says $250 to come in for a visit to have us take a look at that tooth. They go to the hospital emergency room, which is required to see them. In 2019, 152,000 visits, hospitals billed out close to $400 million, 4,300 people admitted to the hospital because the infection was life-threatening. And these two procedures, these two events, hospitals billed out over $625 million, all wasted money, because all that happens in a hospital emergency room is antibiotics and pain medication, and they're told to go see a dentist tomorrow. Well, if they couldn't see a dentist today and had to go to the emergency room, there's not going to be a dentist for them to go to the next day. Now, next slide. 2021, things got a little bit better, but most experts that we have spoken to think this was related to COVID and keeping people out of hospital emergency rooms. But you can see, so the total visits were 116,000. You can see what you were like in Duval County. You had over 9,000 visits to your hospitals that will see these kids. And again, with tremendous billings and with close to 170 hospitalizations because the infection was life-threatening. This is a horrible waste of resources. It clogs the hospital's emergency rooms. Right here in Gainesville, at our UF Health Hospital, we're seeing 10 a day in the emergency room, keeping care away from patients who really need care. Next slide. So this looks at a couple of the what I'll call subtleties of this emergency room care. We have what we call super utilizers, people who go to the emergency room 3 or 4 times in 1 year for the same problem. Florida leads the nation in super utilizers for preventable dental conditions. Look at the bottom bullet, 2020, lead the nation for children under the age of 14 going to the hospital emergency room for a dental visit. Next slide. So I hope I've convinced you that this is a crisis. This is a crisis that has severe economic impact. And now I'm going to talk to you about why it has personal impact. So, as I said in the beginning, this is a good mouth, a healthy mouth. It's not a matter of a pretty smile and fresh breath. There's a whole host of other life functions, our ability to eat and drink properly, our own self-confidence, our social function, our employability. Folks who have dental problems that persist in both childhood and adulthood have severe consequences. Next slide. The literature on this is now unequivocal. And if there's anyone here from an insurance company that provides medical insurance, listen carefully. Diseases such as diabetes, cardiovascular disease, low birth weight, preterm births have all been associated with periodontal disease in adults. More difficult to manage the patient's diabetes, complications of cardiovascular disease. Next slide. A report from Blue Cross Blue Shield. Again, I'm not going to go through all the details of this, but look at the highlighted bullet at the bottom. Members, and Blue Cross Blue Shield had clients, customers who carried both medical and dental insurance so they could get the data and accurately report it. Members with these conditions had nearly 2 fewer years of healthy life expectancy if they had periodontal gum disease. Next slide. This is a terrific study out of New York State, which has now been replicated with one other study. This looked at patients in the New York State Medicaid system. So we'll already have a vulnerable population, and they were able to track medical costs and dental costs and medical treatment and dental treatments. The bottom line with this study is that there was an association between those patients who had preventive dental care and they had improved oral health outcomes and lower medical expenditures compared with those patients who had treatment-associated dental problems that required endodontics, root canals, tooth extractions, and they had higher healthcare costs and poorer healthcare outcomes. The interesting thing is the insurance industry has known this for well over 20 years. And it was only about 15 years ago that they started being forced to publish this data. Their claim was that this was a trade secret, but they were subsidizing dental care to save medical costs over the long term for their patients. And the estimates are that, for example, if we had a dental benefit in Medicare, which we do not, we could be looking at tens of billions of dollars of savings over the next decade. Next slide. Okay, what about children? Didn't mention anything about children. And there probably are 75 papers that hazard a conservative guess in the literature now documenting the relationship between poor oral health, dental pain, dental infections, and missed school days, educational achievement, developmental delays, again, school attendance, and even social confidence, school confidence, things like that. Next slide. So what is the biggest impediment? What stops people from going to the dentist? There's no doubt that not knowing the importance of dental care, and we call that oral health literacy, not knowing the importance of getting your kids' teeth checked and fixed if there are cavities, taking care of your teeth as an adult, making sure you don't get periodontal disease, that is important. But the biggest impediment by all studies that have been done is costs. People simply can't afford dental care. And interestingly, we're not just talking about low-income folks. We're talking about middle income and middle income folks. Dental care is just plain expensive. And people have to make tough choices. Food, clothing, housing, transportation. And just since they don't realize the importance of this, they don't choose to use their limited dollars for costs. Next slide. So what are some of the solutions? Clearly, improving the oral health literacy of the public, and in particular policymakers. Why this is important, why we consider this a crisis. There are things that are happening right now. One of them goes under the general term medical dental integration, trying to bring medicine and dentistry closer. Physicians in the state of Florida now can join physicians in 50 other states and provide preventive dental services to young children, but it's not enough. We can try to attract dentists to work in dental health professional shortage areas in our state. There is a state loan forgiveness problem that is meagerly funded by the state legislature, but it's very expensive and it only has a short-term effect. When the loan forgiveness period is over, dentists move out of those areas. We can try to improve Medicaid reimbursement rates and reduce the administrative hassles that are in our state. But again, the data is this does not have a long-term, positive, meaningful effect on improving access to care for underserved programs. We have federally qualified community health centers that will see patients on a sliding fee scale. But again, there's not enough of them. They have a hard time hiring dentists because it's better to go into private practice. Finally, we can put together some workforce solutions. We have very restrictive Dental Practice Act in Florida, which is interfering with what we call direct access for dental hygienists, and also the implementation of a new oral health professional in the state of Florida that has been adopted in 13 other states in this country, called a dental therapist. And we're going to talk just about one piece of that for what we're trying to do this year. Next slide. So in 2011, the Florida legislature passed what we call some health access legislation. This legislation allowed dental hygienists to provide preventive dental services and screening services in certain kinds of settings, which are called health access settings. And they are listed there on that slide. So it could be a Head Start center, it could be a school-based prevention clinic, it could be a bunch of other sites. That is working reasonably well, and that that children and adults that are seen in those settings can be referred on to a dental office. But it needs some tweaking. And we have done that tweaking. We have legislation. And again, as I said earlier, we have a House and Senate sponsor for this legislation. I've got bill numbers, and we'll be able to share that with you in 3 or 4 days with some covering explanatory language about the simple changes that we're proposing to make in this legislation. And we are looking for folks on this call and other advocates to help support this legislation by contacting your legislators, by talking to your organization. If your organization has a lobbyist, having them push and support this legislation, which will help improve access in the state. I also usually, at this point in the presentation, would also talk about dental therapy, but we're not going to be pushing that this year. We're going to be waiting until next year for a variety of reasons. And again, as I said, this is a solution that has been implemented in 13 states across the country. It is working incredibly well in those states where it is up and running. In other states, we're waiting for educational programs to be implemented. Again, it's a longer process that we'll talk about at a later time. Next slide. So a little bit about us. Our organization is about 5 years old. We currently receive funding from a national foundation called CareQuest for Institute for Oral Health out of Boston. We have over 65 organizations. We are bipartisan. We have organizations that represent right and left of the political spectrum. Our main goal is to provide some tweaks this year to the 2011 legislation. We're very interested in growing our coalition with members who share our hope for improved access to care and are willing to communicate with other organizations. And again, I would use this as a reminder. If you've not done so already, please sign into the chat with your name and your organization. And if you're interested in joining Floridians for Dental Access in your work, write to me and let me know. Next slide. I think so. We do have a website. You can look at it now, but don't hold us accountable for the website. It's not had maintenance for about a year. We're doing that right now, and we expect to have the revision up and running in about 2 to 3 weeks, which will contain a lot of the information that I have presented, plus a lot more detailed information. We need your help, whether you're a hospital, whether you're an organization, or just an individual interested in this problem of oral health access. Next slide. So there's my contact information. There's the website for our organization. There are 2 other organizations I belong to on a national level that I helped co-found. One is the National Partnership for Dental Therapy, and the other is the National Coalition of Dentists for Health Equity. But if you are interested, again, please reach out to me if you like to consider joining or you want more information. My email address is frankdentaltherapy@gmail.com, or my phone number 352-256-5909. Just send me a text or give me a call, and I'll be happy to chat. And with that, I am happy to answer any questions, and I've stayed within my time limit. Thanks for your time.
Thank you, Dr. Frank. Any questions? I will ask you this, Doctor. Is it, what's your sense of the openness of the legislature to make these relatively minor changes?
So yes, right then. Number one, it is important. These are relatively minor changes that will facilitate preventive programs administered by dental hygienists that would then make referrals to a dental office where the patient needs such care. We think things are pretty good. Our lobbyist has spoken with at least one committee chair that we have to go through, and we're getting a positive response. You just never know in the legislative process, particularly in our state, but we're pretty optimistic at this point. Having said that, we really need people to weigh in. We really need organizations such as the Urban League, other organizations that might be on the phone today to weigh in and speak to their legislators about the importance of this. Particularly if you're a hospital that has an emergency department, just talk to your emergency room docs. They are bothered by these problems. They're not trained to equip them. Again, as I said, the only thing that happens in the emergency room is antibiotics and a pain pill. And frequently those are narcotics, which we don't want to get into. And then the patient's told to go see a dentist tomorrow, and that's not going to happen. It is just simply not going to happen.
And I see Dr. Jackson from AME Church is on. I wondered, Reverend Jackson, if you had any questions, or if we could help get the information about this problem to your congregation.
As he was speaking, I was contemplating how we could get this message out to a broader audience. And we can do that through the AME Church. We probably have to set up another Zoom call, and it can go statewide, and we can also invite those individuals from the Bahamas.
So Dr. Jackson, I would be happy to do that, and could work with through Dennis with you to do that. I only mentioned this once during the presentation, but we have lots of data to show that racial and ethnic minority groups suffer very disproportionately from these oral health equity problems, and also then bear the consequences of the effects on school learning and their overall health. So this would be an important message to reach out, and I would be happy to do that at any time. And Dennis will reach out to you, and maybe we can then try to get something put together. Thank you.
Yeah, that would be great. And also, Reverend Jackson, there is a book available that links oral health to spiritual considerations. In fact, Dr. Frank and I worked on a proposal to provide more information to churches on this issue. So I'll send a link to that as well. In fact, I think I may have a digital copy. I'm sorry, what was that?
I said, thank you. I'd appreciate that.
Thank you for being with us. Any other questions? I know, Rafi, you've been working on connecting with various organizations. Is it your sense that going forward, as more and more people hear about this, we will be able to find more people like Reverend Jackson?
Yes, sir. I believe that.
I know that you've been working on adding some organizations to our listing, and I appreciate that. Anyone else? All right, and I put it in the chat, but we did have one person attending from Gainesville via the Facebook, so that was good.
Oh, good.
Yeah, and
Great.
he's actually very interested in working with the Urban League. So Well, if we have no other questions, we will call it a night. And again, thank you, Dr. Catalanotto and
Great.
all the interns that are with us. And I think this was a good meeting, and definitely Reverend Jackson, getting the word out to the AME Church would be fabulous. So
That would be really helpful. I appreciate that. Thank you all for your attention. Enjoyed talking with you.
have a great evening, everyone.